Welcome to the deep dive. Today, we're jumping into a really interesting part of healthcare.
Yeah, histology and cytology.
Exactly. We've got this 2025 market report, and basically we're looking at how tissues and cells get examined for diagnosing diseases.
It sounds specialized maybe, but it's fundamental stuff. Histology is about tissue structure, the big picture microscopically,
Right.
and cytology, that zeroes in on the individual cells. Are they healthy?
Got it. Both super important, especially for things like cancer detection.
Absolutely crucial.
So our goal today really is to pull out the key insights from this report for you. Where's this market going? What are the big trends? Without, getting totally bogged down in jargon.
And it's a significant market we're talking about. For 2025, the projection is USD 11,540 million globally.
11.5 billion.
Wow.
And it's not stopping there, is it? The growth forecast is pretty dramatic.
No, yeah. It's expected to more than double by 2033. We're talking over 29.6 billion US dollars.
That's huge.
Yeah.
What's the growth rate on that?
The compound annual growth rate, or CAGR, is projected at 12.5%.
12.5% year on year. Okay, that's serious growth. So we need to unpack why. Things like early diagnosis demand, AI.
Exactly. All those factors. So should we start with the overall global picture from the report?
Yeah, let's do that. What's the time frame?
Okay, so the report uses 2024 as the base year. It looks back historically from 2021 to 24. And the forecast period runs from 2025 right through to 2033.
Okay, and regionally. North America leads the pack.
Yeah, comfortably. In 2025, it holds over 40% of the market. That's around $4,270 million.
And growing steadily.
Yep, a solid CGR projected at 11.2%.
Okay. Makes sense given the infrastructure there. What about Europe?
Europe's also a major player, over 30% share in 2025, so about $3,347 million.
And their growth, similar to North America.
Slightly higher, actually. Projected CGR of 11.5%.
Interesting. And then there's Asia Pacific, APAC.
Right. APAC holds around 23% in 2025. That's roughly $2,770 million.
Now, I remember seeing something about APAC's growth rate being particularly high. Is that right?
You're absolutely right. This is where it gets really interesting. While the current share is smaller, the projected CGR for APAC is a very impressive 15.4%.
15.4%. Wow. That signals a major shift, doesn't it?
It really does. Big expansion in diagnostic capabilities expected there. And interestingly, South America, while starting from a smaller base, shares that same high CGR projection, 15.4%.
So the fastest growth is happening outside the current dominant regions.
Exactly. The Middle East and Africa have smaller shares too, but South America and APAC are the ones really accelerating.
Okay, so what's fueling all this growth worldwide? You mentioned AI and automation.
Yeah, that's a huge one. AI, automation, and digital pathology basically turning glass slides into digital images. It makes analysis faster, potentially more accurate, allows for remote work.
Right, using algorithms to help analyze those complex images. Makes sense. What else?
A really big driver is just the increasing demand for early diagnosis. Catching diseases, particularly cancer, early on makes such a difference to outcomes. And histology and cytology are absolutely key to that early detection piece. So as healthcare shifts more towards screening and prevention,
The demand for these tests goes up.
got it.
And regulations, how do they play in?
They shape things significantly. Strict compliance rules ensure safety and accuracy, which is vital. But, that rigorous process can also impact how quickly new innovations actually get to market. It's a balance.
Right. Necessary oversight, but potentially a brake on speed.
Yeah.
So what about the flip side? Any major roadblocks or restraints?
Cost is definitely one. The instruments, the really advanced ones, can be very expensive.
So access might be limited, especially in, say, smaller labs or less wealthy regions.
Exactly. That high initial investment can be a barrier to adoption and expansion.
And regulations, while necessary, can sometimes slow things down too.
Yes, the strict compliance, the approvals process, it can add time to getting new products or tech upgrades out there.
Okay, so drivers like early diagnosis and tech, but challenges like cost and regulatory hurdles. What about the big trends shaping the field right now?
Well, there's a constant push for more efficiency and better diagnostic accuracy. That's kind of the overarching theme.
Improving how well and how quickly diagnoses are made.
Precisely. And that ties back into the AI and automation we talked about, but also things like better staining techniques, better imaging.
And the digital aspect, cloud analysis.
Definitely trending up. Cloud-based slide analysis is becoming more common. Pathologists can access images from anywhere, collaborate more easily.
Get second opinions remotely, maybe?
Exactly. It can really speed things up and improve access to expertise, especially for complex cases or in underserved areas.
Sounds like a powerful shift. Okay,
Uh-huh.
let's break down the market segments a bit. You mentioned histology and cytology. Histology has the bigger share now.
Yes, it dominates currently,
Why is that?
mainly because of its crucial role in cancer diagnosis oncology. Histology gives that detailed view of tissue architecture.
Seeing how the cells are organized together.
Exactly, which is often essential for a definitive diagnosis and planning treatment. Plus, you've got advances like immunohistochemistry, using markers to identify specific things in the tissue, and digital pathology boosting its capabilities. It provides a really comprehensive picture.
Makes sense. But cytology is growing faster.
It is, yeah. It's the fastest growing segment by examination type.
What's driving that growth?
Several factors. It's often less invasive, which patients appreciate.
Like a pap smear or fine needle aspiration?
Exactly, those kinds of procedures. It's also generally more cost-effective, which makes it great for large-scale screening programs.
Right, finding things early across a population.
And the techniques are improving too. Things like liquid-based cytology make sample prep better, and AI is starting to be used in cytology analysis as well, so it's becoming more powerful and efficient.
So, less invasive, cost-effective for screening, and getting technologically better.
Okay, what about products, instruments and software versus consumables?
Well, the instruments and analysis software systems segment holds the largest share currently.
The big machines and the brains behind them.
Pretty much, yeah.
Yeah.
Think advanced automation, AI doing image analysis, systems that streamline the whole lab workflow. They're essential for precision, speed, handling high volumes.
The core infrastructure.
Right. They integrate digital pathology, cloud sharing, machine learning. They're the engine of the modern path lab.
Okay. But within cytology specifically, the report says consumables and reagents are growing fastest. Stuff you use with the machines.
Yes, that's right.
Why that specific growth?
It's directly tied to the increasing volume of cytology tests being done. More screening, rising cancer rates.
Yeah.
It all means more need for the stains, the fixatives, the collection kits.
The day-to-day supplies. Exactly. And as labs automate more, they need specific consumables compatible with those automated systems. Plus, there's growth in using specific reagents for molecular tests on cytology samples, for more personalized medicine insights.
So as cytology testing grows overall, the need for the supporting materials just grows right along with it. Makes sense. What about test types? Microscopy is still king?
Yes, microscopy methods dominate. It's the foundational technique, really.
Even with all the new tech?
Absolutely. It provides that essential high-resolution visual information. Pathologists rely on it. And microscopy itself keeps innovating things like confocal super resolution.
So it's not static.
Not at all. Plus, it's integrating with automation and AI, too, making it more efficient. It remains critical for diagnosis and research.
Okay. But flow cytometry is the fast-growing test type.
That's right. Very rapid growth there.
What does flow cytometry do, and why the boom?
It analyzes individual cells very rapidly, thousands per second. It can count them, sort them, look for specific markers on them.
So really good for blood cancers, immune system analysis.
Exactly. Hematology, immunology, infectious diseases. It's incredibly versatile. And again, automation and AI are making it even more powerful for analyzing the complex data it generates.
And it fits with personalized medicine trends.
Perfectly. Identifying biomarkers, understanding cellular responses, it's key for that. Plus, general investment in biotech and diagnostics is boosting its adoption.
Okay, fascinating. Last segment, the end users. Hospitals and clinics have the biggest share.
Yes, that's where most patients get diagnosed and treated.
High volume of tests.
Exactly. They handle the bulk of biopsies and cytology samples. They have the established pathology departments, the staff, often the funding and reimbursement structures to adopt new tech. They're the front lines.
Makes sense. But academic and research institutes are growing fastest.
Yes, that's where a lot of the innovation happens.
Developing the new techniques.
Right. They're researching diseases, looking for new diagnostic markers, pushing the boundaries of techniques like digital pathology and AI in this space.
Collaborating with industry.
Often, yes. Collaborations with biotech, pharma. Plus, they train the next generation of pathologists and researchers, so that fuels demand too. They're the innovation engine.
Okay, great breakdown. Let's put some numbers on the regions now. We touched on North America leading. The U.S. is the giant there.
Absolutely. Projected at nearly $3.4 billion in 2025 and growing at 11% CAGR. driven by tech adoption, high demand.
Didn't catch it.
Around 512 million in 2025, but slightly faster growth projected at 12% CAGR. Innovation, investment, demand.
Mexico also showing solid growth, around 11.7%.
Yes. Strong performance across North America.
Moving across the pond to Europe, the UK, it looks strong.
Very strong. About 562 million USD projected for 2025 with a 12.3% CAGR. Lots of drivers, tech advances, NHS investment, research, aging population needing diagnostics.
And Germany, also a big market.
Even bigger market size, around 663 million in 2025. Growth slightly lower at 11.7%, but still very healthy. Advanced healthcare system, innovation, investment.
France, Italy, Spain, solid growth around 10-11%.
Yes, substantial markets, all showing good growth. And it's interesting, even smaller, wealthy countries like Sweden, Denmark, Switzerland, Luxembourg show CAGRs over 11%.
So really broad-based growth across Europe.
Definitely. Widespread adoption and development.
Okay, now for the high-growth star, Asia Pacific. China's market is huge.
Massive. Over $1.16 billion projected for 2025, and that very high CAGR, 14.9%, driven by tech adoption, huge population demand, major healthcare investments.
And Japan and South Korea, also strong.
Yes, CAGRs of 13.9% and 14.5% respectively. South Korea in particular driven by its growing healthcare sector, diagnostics demand, tech focus.
And India stood out with an even higher growth rate.
Yeah, India's projected CAGR is 17.3%, really rapid expansion expected there from a base of about 277 million in 2025.
Wow, Australia, Singapore, Taiwan, also above 14% CAGR.
Correct. And Southeast Asia as a whole region is projected at 16.2%. It really highlights the dynamism in APAC healthcare.
Incredible growth story there. What about South America, the other high KGR region? Brazil leads.
Yes, Brazil projected at about 188 million USD in 2025 with 13.5% growth. Strong demand for innovation there.
Argentina.
Around 74 million base, but a higher CAGR of 13.8%. Again, advancing healthcare, rising demand, tech innovation, investment.
Colombia, Peru, Chile also showing good growth, over 12%.
Yes, solid growth across several key South American markets.
Okay, and quickly, the Middle East and Africa, smaller markets but still growing.
Yes, Saudi Arabia and UAE both showing CAGRs over 13%. Smaller market, about 37 million, but solid 12.5% growth, driven by healthcare investment and tech.
Turkey looks strong too.
Yeah, 13.6% CAGR, advancing healthcare, research investment, focus on precision diagnostics.
Yet in Africa, Nigeria.
Nigeria is showing 8.7% growth, driven by rising demand, investment, tech adoption, and importantly, training initiatives. South Africa has a larger market, but slower growth at 9.4%.
So really a global picture of growth, just at different rates. And competition sounds fierce.
Oh, absolutely. The report calls it highly competitive. Companies are pushing hard on innovation, especially with AI and digital pathology.
Driven by the need for better cancer diagnostics, automation.
Exactly. Plus, rising healthcare spending generally fuels this competition. Companies are innovating, forming partnerships. It's a very active space.
Any recent examples?
Yeah, the report mentions a couple from late 2024. Histo has launched an advanced system for managing preserved tissue blocks, integrating it with digital access.
Speeding things up.
Right. And ViewWorks introduced a new high-res digital pathology scanner, the Lucian 510, with advanced imaging features for both histology and cytology.
Just shows the constant push for better tools.
Precisely. Nonstop innovation.
Okay, so wrapping this all up, if you had to summarize the key takeaways from this deep dive.
Well, first, it's a big market globally, already over $11 billion in 2025. Second, it's poised for really substantial growth, looking to hit nearly $30 billion by 2033.
Driven by that need for early diagnosis and tech like AI and digital path.
Exactly. Third, while North America and Europe lead now, the fastest growth is projected in Asia Pacific and South America.
And within the market, histology dominates, but cytology is growing fastest. Instruments lead, but consumables are catching up fast, especially in cytology.
You got it. And finally, it's a super competitive landscape, constantly evolving with new innovations.
It really underscores how vital histology and cytology are in healthcare today, and how technology is rapidly changing the field. It's exciting stuff.
It really is. And it leaves you with a big question to ponder, doesn't it?
Oh.
With AI and digital pathology advancing so quickly, how are the roles of pathologists and lab technicians going to change over the next 10 years or so? What new skills might be needed? What ethical questions arise with more automation and diagnosis?
That's a really interesting thought, how the human expertise evolves alongside the technology. Definitely something to keep an eye on.
For sure.
Well, thanks for walking us through that complex landscape. And thanks to all of you for joining us on the deep dive. Until next time, keep asking questions.